Uh, how are you, everyone? This is Samuel Sane here at GlenEagles Hospital. I represent GlenEagles Hospital in Kenya, and today I brought a special doctor, a cardiologist, Dr. Rahul Gupta. Doctor,
Hi.
say hi to my people.
Hi.
Yes. Tell us, who is Dr. Rahul Gupta?
Yeah, so I'm an interventional cardiologist and I'm a structural heart specialist. I'm working as the head of the department and director of cardiology and structural heart intervention.
Yes.
So we manage all kind of cardiac issues so you can say A to Z of cardiology is what we manage over here.
Yes.
I have a team of cardiologists which include electrophysiologists, interventional cardiologists like me and a structural heart specialist and peripheral, cardiologist who does more of peripheral work. So we have a combination and we work as a team.
As a team, I like to hear you work as a team.
Yes.
Doctor, tell me before we proceed, who is an interventional cardiologist? And what is the difference between interventional cardiologist and a surgeon?
Okay. So whenever there is a problem in the heart, it can be, for example, the blockages. Okay. Now, interventional cardiologist would treat everything without opening the chest, without cutting any incision on the heart, and we can treat the blockages with the angioplasty without making the patient unconscious. While a surgeon, he opens up the chest to repair the blockages in the heart. Similarly, if there is a valve problem, there are 4 valves in the heart, and if the valves become defective, a surgeon would replace by opening the chest. We would replace it without opening the chest through the groin artery or without any kind of cuts and incision. So interventional cardiologist does everything through transcatheter interventions, like through very small holes, just like we put an IV line, a bigger kind of hole. The surgeons do everything by opening the chest.
Yes. Doctor, you have said about catheterization and angioplasty. What are these things?
Okay, so angiography is a test to know the blockages inside the heart. Okay, so we do it either through the wrist artery or we do it through the groin artery, the upper part of the leg. It's a procedure which will take about 5 to 10 minutes. It is done under local anesthesia, and we can come to know a complete picture about the heart, where we can know what is the percentage of blockages, what are the number of blockages, and also we can calculate various scoring which can tell us whether it can be treated with medication, it needs an angioplasty, or it needs a bypass surgery, open heart surgery.
Yes.
And coming to your other question, that what is angioplasty? So angioplasty is the extension of angiography.
Yes.
You go through the same route, either wrist or the upper part of the leg, and then you open up these blockages with the balloon.
Yes.
And either you put a stent or you put a drug-coated balloon, which is metal-less angioplasty. So now we have advanced to metal-less angioplasty, which is as good or better than even the stent angioplasty, but both have the role. So these are the difference between how do we do an angioplasty, and bypass surgery is like cutting open the chest and making the bypass through the body's own arteries which are there.
Mm-hmm. Doctor, tell us the common diseases of heart.
So I will begin with what are the common symptoms of the heart, so that people can know that they need to go to a cardiologist.
Yes.
Okay, so somebody feeling breathless on walking, somebody getting chest discomfort either in this area. So anything which happens from nose to navel. So if we make a square or rectangle like this,
yes,
any structure which is coming in this area could be a symptom of heart disease. So choking over here, or pain in the jaw, pain in the upper part or lower part of the back, pain in the upper part of abdomen, pain in the arms. So these could represent a heart issue. Similarly, palpitation, where the heartbeat becomes very fast, swelling over the feet,
yes,
okay, dizziness. So these are the symptoms which people should immediately seek a cardiac consultation. This could be a heart disease, not necessarily that it will be a heart disease,
yes,
but these are the marker that there could be a heart disease. Now coming to your second part, that what are the common heart disease? So we need to understand first the risk factors. So risk factors like high blood pressure, diabetes, high cholesterol, then physical inactivity. Actually, sitting is considered as a new smoking. Then addictions like tobacco, especially tobacco products, excess use of tobacco, nicotine, smoking, All these are risk factors.
Yes.
And they are like silent killers. They don't produce symptoms of their own.
Not immediately.
Not immediately, but when the complication has developed, then the person would develop symptoms. The disease which can develop is blockages in the heart, which can lead to heart attack.
Yes.
There could be thickening of the heart muscles in high blood pressure, which can eventually lead to either a stiff heart or a weak heart, which can lead to heart failure.
Yes.
Okay, when we say heart failure, it is not that heart has failed completely. It has failed to perform its duty the way it should perform. So it is either not able to contract well or it's not able to relax well. And then there are valve-related disease. So we have 4 valves. If they become narrow, so valves are supposed to open up in one direction, like this.
All of them.
All of them. And then they close, doesn't allow. So if they are not opening properly, it's the narrowing of the valve.
Yes.
If they're not closing, it is the leakage of the valve. So valve can either become narrow or it can start leaking, which will produce all these symptoms which I have told you earlier, that these are the symptoms of the heart. And finally, there is electricity in the heart. So
Yes.
the electricity can become very fast, or electricity can become very slow. So these are the rhythm disorders of the heart. And there are holes in the heart, and there is a layer around the heart which can become thick, which is called as pericardium, which is a safety bag for the heart. It can become thick in some people. So these are various heart diseases which a person should know. And whenever they have these symptoms, they should consult a doctor who can tell them that, okay, is this a heart problem or not? And if it is a heart problem,
Yes.
what kind of problem it is?
You've said about electricity. How does heart generate electricity?
So, good question.
Yeah.
So, heart has got 4 chambers.
Yes.
Okay, and there is a natural electrical generator of the heart which is situated in the right side of the upper chamber. So we have 2 upper chambers, 2 lower chamber, 2 on the right and 2 on the left. Left upper, left lower, right lower. So the right upper chamber, God has given us a electricity generator which generates the heart rate between 60 to 100. So that's called as normal heart rhythm. So whenever we check, well, heart rate usually on a normal person is around 70, 80. Some people have 60, some people have 80, 90. They are all within the normal range. And this is then generated, and then there are wires within the heart which carry the electricity to the other parts of the heart. And that's how our heart contracts in the rhythm. So love dub, this upper chamber, lower chamber, upper chamber, lower chamber. This sequencing happens because of the electricity in the heart. When we walk, when we run,
Yes.
we need more pumping of the heart. So the electricity generator, it keeps on generating more electricity, because of which our heart rate jumps up. So when you run, your heart rate can become 150, 160.
Yes.
So it's like that.
So you want to tell me that the electricity has negative and positive pole?
Yes. So we have that mechanism inside, which is called as depolarization and repolarization, because of the influx of positive ions and negative ions. So they are there in our cells. So it is one of the most sophisticated machinery which God has created, or the nature has created for all of us.
Pumping 365 days in a year, day and night.
Day and night.
Let's go to coronary heart disease. Tell us more about it.
So this is the number one. Coronary heart disease is the number one killer worldwide in any country. Okay, so most of the developing world, now it has become the number one. In the developed world, it was already number one, but because of the awareness and these sessions like this, where people have become aware, they are taking more preventive care, the incidence has decreased now.
Yes.
Now, the heart is a pumping chamber. It needs blood for itself.
Yes.
So it pumps the blood, but it cannot absorb the blood from the pump which it is carrying. So the heart keeps on circulating. It needs separate pipelines. These are called as coronary arteries. Okay, it supplies the heart muscles.
Yes.
Whenever there is a deposition or collection of cholesterol or the fat inside the coronary artery, it starts becoming narrow. So it will become narrow. And the supply to the heart muscles will decrease. So whenever a person is exerting, whenever the person is walking fast, when the heartbeat increases, it needs more blood for itself. And these arteries, because they are narrow, there will be a demand-supply mismatch. And the person will start experiencing symptoms from nose to navel, any area in between this. And when they rest, heartbeat comes down, they start feeling better because the demand-supply mismatch has gone. So coronary artery disease is basically blockages in the pipelines which supply the heart muscles.
Is it related to pulmonary thrombosis?
So pulmonary thrombosis is a separate entity where pulmonary means lungs.
Yes.
And every organ in the body
Yes.
has to live on blood. So every organ in the body. So they need blood. So pulmonary artery, it supplies the lungs.
Yes.
And when there is a clot formation in the pulmonary artery, it is called as pulmonary artery thrombosis. The reasons for that is usually different. There are people who have tendency for clot formation. They can develop pulmonary artery thrombosis. Or somebody who is in one position. For example, if you have a 24-hour flight, you are sitting in only one position with your leg folded.
Yes.
Your blood can get stagnated. It is like if you have a muddy water.
Yes.
You keep the mud, just water still like this, the mud will settle down.
Yeah.
If you keep moving, it will be mixed.
Yeah.
Similarly, when you keep the blood just like that, static without moving, the blood settles down, forms a clot.
Yes.
And when you move your leg, this clot can go up, travel, and go to the lungs. Because all the impure blood goes to the lungs for purification.
Yes.
So these veins which carry impure blood, when they are stagnated, they can form a clot. So therefore, when we go in the flight, long flight, people say you make a H with your leg, you keep drink lot of water, and keep on moving your legs, so that the dehydration and a static position for long hours can cause the clot formation, which can lead to pulmonary artery thrombosis.
Yes. Thank you, doctor, for this. What about heart failure?
Okay, so as I discussed, heart is a pumping chamber. It contracts and relaxes. So when it contracts, it supplies blood to the entire body.
Yes.
When it relaxes, it needs to receive the blood from the purified blood from the lungs, because that's the blood which is going to pump. So when the heart is not able to either pump the blood, it has become very weak, so it is not able to contract forcefully, or it has become very stiff and it's not able to expand when the blood comes from the lung, it will lead to heart failure.
Yes.
So the blood will start getting accumulated back in the lungs, because of which the person will start feeling breathless. The blood supply to the different organs will reduce, because of which the person will feel tired.
Yes.
The blood which is coming back for purification to the right side of the heart, it will get stagnated and there will be swelling over the feet. So somebody getting swelling over the feet, feeling breathless on walking, and feeling more breathless on lying down and needs to get up, these could be symptoms of a failing heart. So it is called as heart failure.
Heart failure. What about irregular heartbeats?
Yes. So the electricity in the heart beats at a regular interval. It is a very typical sound which we call it as lub, dub, lub, dub, lub, dub. So the heart keeps on beating in a proper sequence.
Yes.
But if there are additional electrical impulses which starts getting generated in the heart, so it is like in a heart, the natural pulse generator is only one. It is the commander for all the cells in the heart.
Yes.
It gives the command that you beat at 70 beats per minute. Every cell will beat at 70 beats per minute. But then there are certain naughty cells. Sometimes they will start generating their own commands. They will start generating their own electricity, because of which these abnormal rhythms, irregular heartbeat starts happening. So if it happens in the lower chamber, it is called as ventricular ectopics. It happens in the upper chamber, it is atrial ectopics.
Yes.
When they start coming in runs, when they start coming in sequence, that is when they can produce a lot of symptoms.
Yes.
And when they come from the lower chamber, they can be dangerous also. From the upper chamber, usually they are not dangerous to the life, but then there are quite detailed evaluation is needed when somebody has these irregular heartbeats.
Yes.
And when the electricity becomes very slow, that means it suddenly stops giving impulses, the generator, or the connection between the upper and the lower chamber gets weakened.
Yes.
The heart rate can suddenly become low, because of which the person can have loss of consciousness,
Yes.
what we say fainting attacks. So fainting attack could be because of the rhythm problem of the heart.
Doctor, before we wind up, we have two more diseases to handle. Heart valve disease and high cholesterol. Can you tell us more about this?
So, as we discussed, first let's go to the heart valve disease. There are 4 chambers in the heart.
Yes.
Each chamber is governed by a valve. Now, if you look at any valve, the function is to allow the flow only in one direction.
Yes.
Okay. So, for example, if we have a valve in a football tube, you can fill the air, but it doesn't come out. So the valve, the function is to allow only one direction.
Yes.
And
One
to lock.
direction.
Yes.
No.
Yeah, so from the upper chamber to the lower chamber, the valve will open, and when the lower chamber compresses, it will close, doesn't allow the blood to go back. Okay, so similarly from the lower chamber to the main arteries, there is a valve. So these valves, when they have a difficulty in either opening properly or closing properly, there will be a valve disease.
Yes.
Now there could be a mild problem, there could be medium problem, or there could be severe problem.
Yes.
So when the valve becomes either severely narrowed or it is severely leaking, a person would start having symptoms like breathlessness, palpitation, dizziness, swelling over the feet, transient lost fainting attack. And if that happens, the valve may need either a repair or a replacement.
Yes.
And this can be done either surgically or through transcatheter, which we interventional cardiologists do without any kind of cuts and scar on the chest to the groin artery.
Okay.
But whenever we make a decision whether it is person would need a surgery or whether person can be treated without the surgery, it's always a heart team discussion where the surgeon and the cardiologist, we all sit together and we decide what is the best strategy for the patient, and then accordingly we go ahead and treat the patient and they become better.
Wow. High cholesterol.
High cholesterol is basically, you can say, an ingredient for making the blockages. So somebody who has got high cholesterol, this high cholesterol is the bad cholesterol, which is LDL, the low density lipoprotein, and there is another lipoprotein which is called as LP little a. When these are high, they tend to get deposit in these arteries. Okay, so they can develop in the arteries of the heart, where we get coronary artery disease, which can lead to angina, heart attacks. If they develop blockages in the artery of the brain, they can cause stroke and brain stroke, which the person becomes paralytic. And if these cholesterol develops in the leg artery, it can develop gangrenes and peripheral vascular disease. So cholesterol is a risk marker. Higher the cholesterol, higher are the chances of developing blockages in future. So it's a risk marker. It doesn't tell whether you already have developed a blockage. It tells us that if you have high cholesterol, there are high chances of developing the blockages. High cholesterol doesn't produce symptoms. So the important message is that if somebody has got high cholesterol, they need to take action through lifestyle changes, diet, exercise, good care of their, having a good sleep, and going away from the addictions, and regular checkups. And if it's not helping the lifestyle changes, then we should not shy away from taking medications which can prevent these future events. So it is an investment for future.
For future. Good. Which are these foods that promote good cholesterol?
So good cholesterol is called as HDL. HDL, like for example, almonds, walnuts, the flax seeds, anything which contains MUFA and PUFA, these are healthy fats, they can increase the HDL. So, and exercise is one of the most important factor which can increase the HDL, the good cholesterol. So if we have healthy fats, if we have exercise in our regime on daily basis, it will tend to increase the good cholesterol and also reduce the bad cholesterol.
Wow. Doctor, let's us wind up. But before we wind up, tell us about heart transplant. Do you do heart transplant?
Yes. So when we were talking about the heart failure patients, now usually when we treat heart failure patients, there are 4 pillars of heart failure patients where we give medications and all. Majority of these patients, they start improving. Few of them will not improve, and they might benefit from devices like the CRT device, cardiac resynchronization therapy, or a biventricular pacemaker, which can improve the heart function by synchronizing the contraction of the heart muscles. If the patient is not eligible for that, or if that has failed or is not helping, then the final thing is a heart transplant.
And where do you get the heart from?
So 2 sources. One is somebody who's a brain dead patient, a human who has suffered a road traffic accident or has developed a brain stroke, and he is now otherwise a vegetative state where he's brain dead. Brain is no more functional, but the heart is still functioning. These are the patients who can donate their hearts, and these are the patients who can give lease of life to so many people because their liver, heart, kidneys, everything can be transplanted. And the other source, so one is from the humans who have just died and who are willing to donate, who have become brain dead and they are willing to donate, the relatives are willing to donate. Then we get the heart. Second is the artificial heart. So these artificial hearts are available.
Well, I've never seen them.
So the artificial heart are the machines.
Uh-huh.
These are the heart pumps.
Heart pumps.
Yeah, heart helmet.
Mhm.
They work on electricity, which is implanted by the cardiothoracic surgeons.
Yes.
And then you have a battery which you are carrying,
Mhm.
which is rechargeable battery and all those things. And
Just like a laptop
just
or a
like
phone.
that. Yes,
Are they costly?
they are costly.
Like how much?
So the LVAD, these devices will, if I don't know, can I tell you in Indian rupees or
Any can do. Any can do. In dollars,
in
in
dollars?
Approx 1 lakh.
rupees,
$1 lakh, yeah, around
1 lakh Indian. 1 lakh.
1 lakh.
1 lakh US dollars.
Huh?
So it
So
is.
much.
1 crore in Indian. No, sir, approx 1 crore. Albeit.
It would be around 50 lakhs
Uh-huh.
to 75 lakhs in the Indian currency.
Mhm.
In rupees in Indian currency.
Yes.
We'll have to divide by 100. So 50 lakh is, I think,
50, 70.
somewhere like that. 50,000.
We do the calculation. No worry.
Yeah.
Uh-huh. So, fully functional.
Yes.
So, no need to die. No need to die. If they-
Because of the heart disease. So
Mm.
the reasons for death can be multiple.
Uh-huh.
If a heart procedure is done, somebody can get saved from the heart problem.
True.
But there are other reasons to die.
Right. True. I agree with you. That is good.
So
Thank you.
I think nobody should die prematurely. That's what I
Yes.
believe.
Yeah.
Everybody should live a decent life and a happy life.
Mhm.
So the importance of what we say, medical science should prevent premature death
Yes.
and it should improve quality of life.
Uh-huh.
If we can achieve these two things in a minimally invasive way
Yes.
or in whatever way with safety and precision,
Mhm.
I think as a human, as a healthcare provider, we are doing a great job if we can achieve these two things.
Yes.
So that's what I feel.
Ah, wow. Doctor, do you believe in technology?
I believe because I'm lover of technology,
Mhm.
and whenever there is something new which comes up,
Yes.
I always try to learn it, and I want to be the first one
Yes.
to learn it and to start using it in my patients. So I always go and keep on upgrading myself. Whenever the technology comes up,
Mhm.
I would go in those centers.
Mhm.
I would learn them.
Mhm.
I would get expertise with them.
Yes.
If I need the help of those teachers who are teaching me, I would call them from the international location,
Yes.
and whether it is Japan, wherever this technology comes up first,
You are there.
because that's how it spreads.
Wow.
And then I myself become a teacher. Like I'm a teacher for a lot of newer technologies where I go all across the country
Mhm.
and I teach my fellow doctors and all so that they can also learn and they can also finally treat their patients on their own.
Yes.
That's how the knowledge also spreads, and that's how we learn. All of us learn that way.
Wow. I wish you to come to Kenya, actually, to speak to our young generation who wish to be doctors like you, who wish to be cardiologists. Would you
Right.
mind to come?
100%. I'm very happy, and I'm very keen. I have keen interest towards the academic research training.
Mhm.
I am a teacher for DNB students, which is one of the the courses for training.
Yes.
So I conduct exams, I train. So I love that, and I will be very happy to
Oh, I'll go
be there and
I'll arrange
discuss.
for you coming.
Yes.
To meet a young generation who
Yes.
wish to be doctors like you,
Great.
at least to inspire them.
Yes, yes.
Yes. Thank you so much, Doctor.
Thank you. Thank you.
My people, this is Dr. Rahul Gupta, one of the best and world-class doctor in Mumbai, India. Wishing him well in his endeavors, treating patients from Kenya and the whole of Africa, and mostly the whole world. Thank you. Please don't hesitate to contact us, and don't hesitate to talk to doctor. He's ready to have a video consultation with you. Please call us. Thank you.
Thank you.